we kind of dove right in without really getting to like what flight nursing is and like how we get there. How did you get there? Like what does that
Uh,
look like?
so it was a little bit easier when I got into it. I have to say, when I was a medic, we only had one or two aircraft in the air, and one of them was being Life Flight 2 out of State College and Life Flying. I worked in a small community hospital as a single provider paramedic on a chase truck, which is just like a Chevy Suburban for a lot of territory. And so you became seasoned quickly. And then when I went into nursing, so I knew I wanted a little bit more of this. I went right into, I had the luxury of knowing family in a cardiac intensive care unit. So went right into a unit where all open heart surgeries. Um, but then for some reason, after a couple of years, I was missing I guess the chaos. I like to say it that way. But being in control to go outside, take a breath of fresh air, not always being inside a hospital all the time. So I knew that I wanted to go back to something, and I knew flight nurse was probably going to be the best avenue.
Yeah.
So to get that, it ranged from having the pre-hospital credentials was a benefit for me. It is a requirement to be a flight nurse is to have what we call in Pennsylvania pre-hospital RN, which is a credentialing on the street side. So knowing that aspect of it and intubating patients in the field without medications back in the day when it was so old ago, so many years ago, and so it was a different game, but it also gave me the tools to use getting into flight nursing. And
Yeah.
then, as anything else, credentials, we have JACO. I think a lot of people know what JACO is. And we also abide by a CAMES accreditation, which is a specific air medical and ground transport accreditation. So they require a lot more licenses as far as your ACLS, your PALS, and neonatal stuff, um, and then critical care certifications, and everything becomes a very expensive game.
Yeah.
And then it just got into it. Started in the city EMS in Pittsburgh, actually, and it was Stat Medevac. It was my first flight
Oh,
program that
wow.
gave me the opportunity, believe it or not, at Stat 9. So hats off to them to give me an
Yeah.
opportunity for my first experience. And then when something opened up at Life Flight, because it was very hard to get in there, that's when I took the opportunity getting in.
Wow. Well, I feel like I know you, but then you talk about all this stuff, and I'm like, I didn't know this. This is so cool.
Yeah, it's a lot of stuff packaged in. It all happens quickly. I think
Yeah.
that's part of the game, and everything happens so fast, you just forget
Yeah.
about it. And as you think about it, you're like, wow, there was a lot you things going on back then. So
Yeah, and to kind of have to dive back in and be like, "Wait, I did
yeah,
that. I did that." You forget that you do all
yeah,
this, you do all this stuff. Just I actually listen to it's hard to listen to yourself like after recording the podcast because you're like, "Oh."
uh,
But when I went back and listened to my episode that just was released, I talked about my flight experience, and you almost get lost in it because you
mm,
forget the things that happen and what you go through, and then you're like, oh my gosh, I actually did. I did that. How did I do that?
yeah,
And just
yeah,
just all the certifications and the training that you guys have to keep track of, like that blows my mind. Like I can
yeah,
barely remember to get my NRP and my
right,
BLS, and then you're like,
yeah,
oh shoot.
yeah,
Or like your
yeah,
yearly TB tests. I think hospitals are still doing that. I think that's absolutely crazy. But, it's like, oh, I'm overdue for that. Like, it's just, there's so much as a nurse that you already have on your plate, and just
yeah,
adding all of these other certifications. And, it made me think about how with Life Flight's program, there was the neonatal team, the nursing
yeah,
team. So they like, not that you didn't have to worry about NICUs, but you
yeah,
still did because
yeah,
you would go out with and I don't know if things have changed since I left, but it would be me and sometimes just you
yeah,
out there. So if I couldn't do it, I had to make sure you knew how to do that too. So
yeah,
it's like even though you had that team, you're dealing with birth, premature birth, all the way up till end of life. Like that's a lot of skill to
yeah.
have and a lot of knowledge and competencies to keep up on.